Allergies are rising. Every third or fourth person says that they are suffering from allergies. Where are things going wrong? Why is allergy becoming so common? This is a question that I receive almost every day in my practice and even when I'm in social circles. So today, friends, we're going to delve into the reasons why allergies are rising in 2026. When we look at the causes for rising allergies, we have to realize that now, today, even young babies, newborns, infants, toddlers, are suffering from allergies. It starts off as eczema, which is a skin allergy, sometimes with or without food allergies. Later on, there's nasal allergies, and then there is asthma or wheezing problems. And this can then progress and come up even later on in life. In teenage years, as a young adult, as a senior citizen, allergies can show up anytime in life and they're clearly increasing. The story begins in the womb. The mother's diet, the mother's lifestyle, the mother's stress levels, and the mother's gut microbiome, her bacterial flora in her gut are all shown to influence the baby's future risk for developing allergies or asthma. And when we look at this, it is very clear that also being born by a cesarean section versus a normal birth canal delivery also makes a difference to the risk of certain types of allergies or other problems. If we go one step further, the baby's diet becomes very, very important. The number of antibiotic courses that the baby is given, if it's repeated and frequent, it changes the gut flora of the baby and alters their immune response to how they respond to the environment, because 90% of the training of the immune system happens in the gut, at least 70% if we may not push it. Recognizing that these are early life factors, the next thing that is very, very important for rising allergies is air pollution. Now, there are two types of air pollution. There can be indoor air pollution, things that we burn or use or do inside the home, and then there's outdoor air pollution. One we have control over, one we don't. But both of these forms of air pollution, whether it is increasing diesel exhaust fumes, whether it is indoor burning of things that can lead to air pollution, they all influence the lungs, the nose, the sinuses, the breathing, and hence they become causes for rising allergies. When we look at subsequent factors, it becomes very important to recognize that infections can sometimes be the trigger for allergies coming up. So early life, respiratory syncytial virus infections, influenza infections, rhinovirus or common cold infections, these can all predispose to future risk for allergies in some individuals. When we look at the westernization of our diet and lifestyle that is occurring, we see that with more and more people eating processed and ultra-processed foods versus eating natural diets with more vegetables and fruits, the ultra-processed foods and the processed foods high in salt, high in sugar, high in refined flours have a huge impact on how our gut flora, and hence our immune system behaves. And that becomes a major cause for rising allergies worldwide. So the Western countries where allergies were very high even in the 80s and 70s, we are seeing the same trend in the 2000s in a country like India. And this is a very big role that the diet and lifestyle is playing. Combine all this with stress levels. As stress levels are increasing, mental stress, emotional stress, physical stress, the body goes under a strain pattern in which its immune responses can change. And these changed immune responses can give rise to not just allergic diseases, but also things like urticaria, hives, rashes, a response that is an imbalanced response to something naturally in the environment. So, friends, as you can see, allergy is a multifactorial disease. There are many causes and reasons why they occur. But when you look at the perfect storm, and when you take this on the background of a child who is born to parents who have allergies, to a father or a mother who has a history of asthma or eczema, these diseases are really rising at a very rapid rate, and we have to become aware of these causes and get an early allergy skin test done, which is the most clinically relevant allergy test, and figure out whether those tests are relevant to the symptoms that are there and really do interventions early. Interventions can begin with things that can be done with the mother during her pregnancy, post-delivery with the baby, and subsequently even with young teenagers, adults, and senior citizens, such as altering their gut flora, changing their diet and lifestyle, including more exercise, outdoor activities, sunlight. All of these things can go a very long way. So friends, I hope you have more clarity on why allergies are increasing so rapidly in 2025, 26 and beyond, and we can do something about it as a collective effort. Till the next video, take care, stay safe, and God bless us all.